My name is Mónica Cenillosa. I am a doctor at the home care of the Hospital Italiano de Buenos Aires, Argentina, and I will present mobile application for home health care, physicians' expectation and perception. Home care is an important and effective way of managing chronic illness using scaled multidisciplinary team care at home. EMR platforms provide better continuity of care, simplify data collection, decrease overhead costs, reduce mortality rates for the chronically ill. For home care, having a longitudinal record that collects every piece of information is even more important. Unlike hospital and ambulatory setting, clinicians visit patients at home at different times, independent of each other. The basic EMR functions for home care are collection, documentation and retrieval of information regarding demographic information, lab and imaging results, prescription, nursing observation. The use of mobile device for registering data at the point of care has increased, and different studies have demonstrated its usefulness for physicians, nurses, and other healthcare professionals. The use of a handoff system promotes completeness of written information, especially if there are robust interface between the EMR and mobile platforms to promote entry of complete and accurate data and to enhance provider workflow. A Spanish study found that the use of an app to check and record data in the EMR during the home visit saves time for professionals and helps to avoid transcription errors. The general objective: design and implement a mobile application that allow home care professionals to have an agile and secure platform to provide access to the relevant information of each patient, allow the registration at home, avoid errors, and optimize working time. This article shares our experience with the design and implementation of such mobile application with EMR functionalities for the home care setting. The Hospital Italiano is a large hospital located in Buenos Aires, Argentina. It has 2 university centers, 750 inpatient beds, 200 of which are for intensive care, attend 3 million outpatient consultations per year. The home care attend 3,500 patients at home, 2,900 patients in chronic care, 600 in acute care. 2,200 of them are complex chronic patients with high morbidity and high mortality, and 150 professional work, including doctors, nurses, and physiotherapists. The hospital has developed and upgraded a homegrown information system for the last 20 years. It was certified as level 7 in the EMR adoption model by HIMSS. It works in different clinical settings: outpatient, inpatient, emergency, and home care. 2016, Hospital Italiano developed a mobile application for its healthcare personnel with different functionalities to match their work processes. In the app, the display information is an excerpt from the patient desktop EMR with lab results, fluid balance, assigned tasks, principal diagnosis, medication list, allergies, write clinical notes, speak recognition. This project was a joint effort between the home care section and the Department of Health Informatics. An agile approach with a minimum viable product and continuous iteration allow to roll out a pilot and quickly detect improvement opportunities. We conducted a mixed method study with qualitative and quantitative research regarding physicians' situation and expectation, pre-implementation and perception post-implementation. The survey was based on a published, validated questionnaire to measure the quality of experience in mHealth application. In December 2019, we conducted a survey within home care physicians and nurses with the aim of identifying access problems to the EMR in home care. The survey was anonymous using Google Form with 9 structured questions and 2 open to free text answers. The question include the type of device used, type of connection, internet quality and provider, EMR module with greater access difficulty, among others. We received 32 responses and we confirmed that almost 80% of the respondents had difficulty accessing the EMR on a regular basis. Even though there were some clinicians accessing through their smartphone, around 75% used desktop computer. 70% of the participants thought that a mobile app will facilitate the EMR access and ease their workflow. The first phase of the project was to roll out a minimum viable product as a pilot. Given the functionality of the app, it allowed home care doctors to access the EMR of their patient at the point of care, to check other physician notes, check laboratory and imaging results, check their medication list, write clinical notes by free text input. The mobile app was tested and deployed in late October 2020. Then we selected 5 physicians and gave them access to the mobile application. We conducted a satisfaction survey among pilot users with preliminary results showed a high engagement with the mobile app, with 100% of the users accessing to check their patient EMR. Most users agreed that it was easy to learn and easy to use. 60% agreed that the app allowed them to do things that were previously not available. 60% believe that it led to an improvement in workflow. Most users agreed that it allowed easy but secure access to patient information at the point of care. The need of a mobile app to access the patient EMR at the point of care was highlighted in our initial surveys. The first perceptions were very good and prompted the rolling out of the app to all clinicians participating in home care, while conducting a wider usability and satisfaction study. Our application is similar to that implemented in a Spanish study, except for the lack of prescription and lab test request functionality. The team is conducting a larger usability and satisfaction study, including a representative sample of home care physicians. The home care is also participating in a new trial of efficiency, effectiveness, and satisfaction of the speech recognition functionality within the mobile app. Our research was done in a single academic center using in-house developed software and thus might not represent other institutions. Conclusion: the use of a mobile app to check and record data in the EMR during the home care visit had a global positive expectation and perception from physicians from our network. Thank you very much.